Welcome, everyone. My name is Jeff Manzella, and welcome to the first of our retirement webinar series for the month of September. Excited today, we have Jim Bokshan on to talk about Medicare. First of all, a couple of housekeeping items. Want to make sure everybody can hear me. Can I get everyone to go ahead and raise your hand? It should be at the bottom of the screen. Okay, great. Looks like you got a few people who can hear us. A couple of you are calling in. Great, you can hear us. Perfect. So you are on, most of you are on, I'm going to go ahead and lower your hands for you. So if at any time you have a question, you can go ahead and raise your hand. We do have, if you look at the bottom also, there is a question and answer. You can go ahead and type it in there. And I will, at the end of this, we're hoping it'll be about 45 to 50 minutes. And then we'll be able to take questions and answer afterwards. And so go ahead and type in your questions there. I'll be able to sort them out and we'll be able to answer them afterwards, or go ahead and raise your hand and we'll try and get to you as soon as we can. If there's any questions about anything, Jim's been in the business over 27 years. He has his own firm out of Troy, lives in Shelby Township, and he's a great resource for Medicare, and that's why I'm having him on for our team and a lot of our prospects today who it's such an important concept, Medicare. So let's go ahead and gonna get Jim on to get this started.
Okay, so can you hear me?
We can. Cannot see you yet, though.
Okay.
Let's see here. I'm going to go ahead and make you the host.
All right.
And then you should be able to make yourself visible there, like we did last time. That'll work.
All right, can everybody see me now? Not that
Sure
you want
can.
to.
Yes,
anyway, thanks, Jeff. My name is Jim Bokshan, and I've been a health insurance consultant for about 27 years now, as Jeff said. And in that time, a lot has changed in the health insurance market. But the one thing that hasn't changed is that nobody understands Medicare, how it works, what it entails, how to enroll, and the penalties if you don't do it right. So what I try to do is, in about the next 55 minutes, is give you the basics. There's a lot of information, so forgive me if I talk fast because you don't want to be here all night. So I'm going to try to condense all this into, again, a 55-minute presentation. And what we're going to do is we're going to start off right now with a slideshow. Okay, I'm going to share my screen. All right, and we're going to start the slideshow right now. Okay, so we should be able to, everybody see that, the basics of Medicare? What this is, first of all, Medicare, all right, there's a lot of confusion between Medicare and Medicaid. Medicare, the way I remember it, is for people with gray hair. Medicaid is for people that need aid. They're the ones that are indigent, and that's what the state provides for them. But Medicare is a federally run program that we've all paid for through our FICA taxes, all right, all those years that we worked. All right, so when the government says, yeah, we're giving you Medicare, no, they're not. We paid for this all our lives, okay, all our working lives, all right? So what is it? First of all, it's health insurance for three groups of people: those 65 and older, those under 65 that are disabled, and those with end-stage renal disease, which is kidney failure. It's run by the federal government. It's administered by CMS, the Center for Medicare and Medicaid Services, which is a division of Social Security. Now, if you're collecting Social Security, if you started early at 62, 63, you're automatically enrolled into Medicare. You'll be getting a card, a red, white, and blue card, about 3 months before you turn 65. So you will have to do nothing to get enrolled in Medicare, because Social Security will do that automatically for you. Okay? If you're disabled, they'll also take care of it for you 3 months before your 2-year disability period is up. Okay? So if you don't want Medicare because you're still working at a large employer, in that enrollment package they send you, there's going to be a little letter to decline Part B, because you do not need Part B when you're working at a large employer. those with 20 employees or more. Because with those type of companies, your health insurance is primary, Medicare is secondary, which means you don't need the Medicare and you don't need to pay for Part B. So if you're working at a large employer and you want to keep your company plan, you want to decline Part B. Okay, how to enroll in Medicare if you're not receiving Social Security? Basically, a couple ways. You can enroll at your local Social Security office if they were open, but they're not. So you basically have to call the 800 number now on the screen here and set up an appointment to get enrolled. So you call first to set up an appointment later to get enrolled. Rarely do they ever enroll you right at the same time you call. You can also apply online at that website I showed you there, socialsecurity.gov. There's also another one called medicare.gov. You want to sign up 3 months before you turn 65. I'm going to show you the timeline in a second. Okay, but again, you don't have to be retired to get Medicare. You can still continue to work and get Medicare. Okay, the timeline. You have a 7-month window to sign up for Medicare when you turn 65. You have your birthday month. You have 3 months before that and 3 months after that. Now, most people want to sign up before that because the rates are so cheap. It's usually a lot cheaper than certainly an individual plan would be, and most often what your employer plan would be. So what you want to do is start early because there's a lot of baby boomers turning 65 every day in this country. So, and Social Security, as you know, is backed up because of this whole COVID crisis. Yeah, I would suggest definitely starting 90 days before you turn 65. Okay? You also have your birthday month, which Medicare kicks in the first day in the month that you turn 65. So no matter what day you turn 65 in, say, October, your Medicare will kick in October 1st. Except for, there's always exceptions, if your birthday is October 1st, your Medicare actually kicks in September 1st, a month early. Okay, but for the rest of us that have birthdays, throughout the month after the 1st, your Medicare will kick in the first day of the month you turn 65. If you miss that 7-month window to get into Medicare, you have a general enrollment period from January 1st to March 31st. And that time you can sign up for Medicare, but what's going to happen is you're not going to be eligible to July 1st, okay, which means you're going to go without your Medicare Part B for at least another 6 months. So you definitely want to sign up when you're supposed to, meaning when you turn 65 or say when you retire. That's called a special enrollment period. When you retire, or say maybe you move out of the area, so you move from Michigan to Florida, that's a special event. Maybe a divorce, a disability, those are special events. You also have an open enrollment period at those times as well. Okay, but yeah, if you miss your 7-month window, you cannot enroll to the first of the following year. Okay, Medicare comes in 4 parts: A, B, C, and D. Part A is free. Okay, first of all, Part A and B come from the government. Parts C and D come from insurance companies. A is free, B we have to pay for. So Part A is our hospital insurance. It covers hospitals, skilled nursing facilities, home health care, and hospice care. You don't have to pay for Part A if we've worked at least 10 years and paid our FICA taxes, either through our employer or through a self-employment arrangement. So if you haven't worked but you're married, you can also qualify through your spouse. So say I'm Mr. Mom, I haven't worked, and ever. I married a woman who was a nice career person. She worked all her life. I can qualify under her for my Medicare Part A and B, but it's going to be free to me because of her working all those years. Here are the deductibles and the co-pays for Part A. Don't pay any attention to the slide. I just want to show it to you because these are all the different co-pays, deductibles, the costs that come out of our pocket if we don't have a Medicare supplement. This is why we buy a Medicare supplement, is to cover all of these costs. Typically, Medicare covers about 80% of the costs. We have to pick up the other 20%. And that's why we buy a supplement plan, is to cover that 20%. So I'm just showing this to you here just to show you what's kind of behind the scenes if you don't buy a Medicare supplement. Right, so do I need to sign up for Part A? Well, it's free, so why not? Okay, Beneficiaries can pay for it if their work history is sufficient. Or it should say they pay for it if their work history isn't sufficient. So if they didn't work the 10 years, they have to pay for Part A, but that's very few people out there. There may be a penalty for those who delay. If the beneficiary spouse is actively working and covered by an employer plan, okay, you're still going to be covered for Part A. But here's the key. Once you become Medicare eligible, and let's say you decline Part B because you're working at a large employer, you have to stop contributing to your health savings account if you still have Part A. So as long as you have either Part A or B or both, you cannot contribute to your health savings account. What you can do, though, is decline both. So say you turn 65, you're still working at your company, you plan on working for a few more years, you still want to start, keep contributing to your HSA, you want to decline Parts A and B to the, through the Social Security office. Okay, and that allows you to keep contributing to your health savings account. All right. Lastly, the private insurance doesn't have to pay if your primary members aren't enrolled. What that means is if you work at a company with less than 20 employees, the insurance company, I'm going to pick, for example, Blue Cross, okay? They won't pay your claims. They're going to send you a letter saying, look, you're eligible for Medicare Parts A and B. If you don't sign up, we're not going to pay your claims. So those are for people that work in small businesses, under 20 employees. If you work at a large company, you don't have to worry about this. You don't need Parts A and B because your health insurance is primary. But for small companies, Medicare is primary, and the insurance company, whoever it is going to force you to sign up for Medicare, or they're going to start denying claims. Part B. Part B is our outpatient services, like doctor's office visits, diagnostic tests, labs, x-rays, outpatient therapies, mental health services, and our preventative care, which is the next slide. We still get all this for free. Under the Affordable Care Act, aka Obamacare, we all get free preventative care. So we get our free annual physicals. The women get their mammograms and their pap smears for free every year. The men get their prostate exams, PSA exams done. We allow these other things here you'll see for cardiovascular, diabetes, bone mass, a lot of the vaccinations, the flu shots will be free. Don't know yet about the COVID vaccination, if that's going to be free or not, when they do come out for one, with one. But most of this basic stuff will be free under Medicare. Now, Medicare we have to pay for. If you're in an income tax bracket, as a single person, you're making less than $87,000, the monthly cost for Part B is $144.60. If you're filing jointly as a couple, it's $174,000 is the limit. So if you're under that, you pay $144.60. Now, if you're over that, you're going to be paying more. This is for each of you if you're married. So husband and wife each have to pay this extra Part B if you're Medicare eligible. Now, up in the left-hand corner there, you'll see it says if your income in 2018 was. The government, Medicare, looks back 2 years at your income to determine this year's Medicare Part B premiums, which means if you had a good year back in 2018, maybe Jeff got you a huge windfall, okay, in your stocks and your mutual funds, or you sold a cottage up north, or you cashed out of something, or maybe both of you were working and now one of you's retired, okay, and you're not making that kind of income anymore. The secret here, and you're not going to hear this from anybody else, but in this type of forum, is you have to file an appeal with the federal government to say, look, I'm not making that kind of money anymore that I was in 2018, or it was just an aberration year where I had a big windfall. I want to be judged on my income in 2020. So if you file as a form with Medicare, the appeal form, they will lower your rate to your current 2020 income, which means, like this, for an example here, if my wife and I, for instance, filing a joint tax return, let's say we made $350,000 back in 2018. $350,000, the cost for our Medicare Part B is $462.70 each. Okay, and if say I'm retired or my wife retired and we're now down below $174,000, I'm going to be paying $144.60 each. That's a difference of $322 a month per person. So it's what $644 for for the month. So yes, you definitely want to check with Medicare to file that appeal if you're in a lower income tax bracket after you start collecting Social Security. Because remember, they look back 2 years, and they're going to verify this with the IRS. So when you file your taxes in April, and say you said you're going to be below 174 and you weren't, they'll come back and charge you the extra premiums. Okay, so you can't get away with them, basically underestimating your income. They're going to find out, sooner or later. But if you are, the key is don't pay the higher rate. It's going to take 2 years for them to catch up. So don't wait for that. File the appeal. Now, cost for Part B services, similar to when I showed you with Part A, we have a 20% co-insurance on most services and some co-payments, plus a yearly deductible of $198. But again, these will all go away if you purchase a Medicare supplement or Medicare Advantage plan. Now, when can beneficiaries enroll in Part B? Well, again, we have our automatic enrollment period when we turn 65. Okay, we have that 3 months before the month we turn 65 and 3 months afterwards. There are special enrollment periods. So if you're in an employer group health plan, you're currently working, you're over 65, you can leave that group plan at any time. So what I'm finding out now by doing this for a lot of large employers, in fact, I did one last night, if you're in a plan that says maybe it's an HMO, maybe it has a $4,000 deductible, or maybe you're paying a lot out of your paycheck for this health insurance, you can get out at any time and go on an individual Medicare supplement. Now, both you and your wife can do that, okay, if you're over 65, or if one of you is under 65, you can get an individual plan, or maybe get their COBRA plan for 18 months. But you do have options, okay? But the key here is you can enroll anytime you want into Medicare if you're on a group plan. Now, the key here under special enrollment periods, where it says retiree and COBRA coverage aren't considered active employment, the government does not recognize COBRA as creditable coverage, which means if you go on COBRA and you're Medicare eligible, the government looks at that as if you had no insurance at all. So if you didn't sign up for Part B when you were supposed to, you're going to get a late payment charge / penalty. And that penalty lasts the rest of your life. Okay? I'm going to go over that again in the next slide, but down below where it says general enrollment period, again, if you miss your enrollment when you retired or maybe when you turn 65, you can always enroll at the beginning of the year from January 1st to March 31st. It'll be effective July 1st. There will be a premium surcharge for late enrollment when you didn't sign up in time, and that charge is 10% for each 12-month period you did not sign up for Part B when you should have. So I'm going to go to the next page here. Okay, the late B enrollment penalty is 10% for every year you didn't sign up when you're supposed to. So I had a gentleman, he was the CEO of a large real estate company in New York City, lives here in Franklin, Michigan. His HR department didn't tell him about signing up for COBRA. He went ahead and did that. He had the 18 months. Then when he came to me to get his Medicare plan, I said, look, I can't help you. You don't have Part B, and you can't get Part B until next July 1st. So he went a full 2 years without having Part B, which means he's getting charged now 20% extra on his Part B premiums every month, and that's going to last for the rest of his life. That next line where it says members have to pay the penalty as long as they have Part B, which again is going to be the rest of your life. So do not go on COBRA when you're Medicare eligible. That's the bottom line here. Usually, again, it says there's no penalty for those who sign up to a special enrollment period. What that means, basically, again, if you retire, you're disabled, divorced, wherever you move out of the area, that's a special enrollment period. There's no penalty for signing up during that time period. Okay, it's just when you went on COBRA and you didn't sign up. That's the problem. Now, Part B in the employer. Okay, you don't have to sign up for COBRA. I'm sorry, you don't have to sign up for Medicare. If you don't want to, you can stay on the company plan. If you have a company that has more than 20 employees. If you have a small company that are fewer than 20 employees, yes, you have to sign up for Medicare when you become 65, when you turn 65. All right? Or if you have an individual plan, say you're not working, you just have individual coverage, yes, you have to sign up for Part B as well if you have an individual plan, or if you're on COBRA. So let's say you retired early You retired at 64, you're on COBRA. Your COBRA will last until you become eligible for Medicare, and then Medicare will take over. Okay, so the Medicare is going to end when you turn 65, so you must sign up for Part B at that time. Part B and the employer, okay? You're going to get a chance to sign up, you know, through your employer. If it has more than 20 employees, they'll give you the COBRA paperwork. They have to do that within 60 days, all right? But again, you don't want to sign up for it. If you have a special enrollment period, let's say you retire, let's say you retire June 30th, yes, you can sign up for Part B July 1st. There'll be no lapse in coverage, no waiting periods, no pre-existing condition limitations, no health questions asked. So when you leave a company, you can immediately get on a Medicare plan the following day, okay? Now, middle of the page here, this is key. No federal agency is responsible for informing individuals about their obligations and rules related to Medicare enrollment. What this is telling us is, first of all, the government does a terrible job of educating us on Medicare. But yet we're responsible if we make any mistakes. Exceptions are only available to people who can prove they relied on misinformation from an agent in the federal government when making an enrollment choice. I have 3 times now had to correct the Medicare people, their representatives, okay, because they were giving my clients bad information. My clients came to me and said, well, Jim, you know, the Medicare person I spoke to didn't tell me that. They said just the opposite. I had to literally take a copy of the page from the Medicare manual and fax it to that person to tell them their own job. So the rule of thumb here is when you talk to Medicare or Social Security or anybody from the government, record it. Write down who you talked to, the name, the date, the time, and what they told you. Because then if they come back to you down the road saying, oh, you didn't do this, and it becomes a he said, she said issue, you have proof that no, you talked to a person at the federal government and they gave you the bad information. Okay, because again, we're responsible for any mistakes that are made, not them. Part D. I'm going to skip over Part C for now, because Part D is a little bit easier. Okay, Part D is our drug card. Now, it's available. You have to get it, actually, when you become Medicare eligible. You have to have a drug plan. You can get it a few different ways. You can have a Medicare prescription drug plan on its own, which accompanies a Medicare supplement plan, or you can have it automatically included if you get a Medicare Advantage plan. All right? You get that if you have Part A or B with Medicare, and you have to live in the plan service area, which means in our general area, for instance, in the Detroit area, we have 29 different drug card plans available to us. And we have to get something when we turn 65. Now, we could have something else, okay? We could have our company plan. We could have VA coverage. That all counts. But if you don't have Part D when you sign up for it, there's going to be a penalty. Just like there's a penalty for Part B, when we don't get Part D within the 63 days after applying or qualifying for it, the penalty is 1% of the average national base Part D premium, which comes out roughly about 32 cents a month. And it compounds for every month you didn't have it. And every year during open enrollment, I usually have at least one person, and it's almost always a gentleman, that comes to me and says, well, I didn't need to sign up for a drug card. I didn't want one. I didn't take any drugs, or my generics are really cheap. I didn't see the need for a drug card. Well, I have to be the bearer of bad news now, sir, to tell you that the last 5 years you went without a drug card, you're now going to be penalized by the U.S. government. And then they're going to add that to your Part D premium. So if you go 5 years without a drug card or drug coverage, the penalty is roughly about $19. You take 32 cents times 60 months, about $19 a month. That's going to be added on to your Part D, your drug card premium, for the rest of your life. So again, these Part B and Part D penalties last the rest of your life, so you don't want to mess up, okay? Now, the exceptions are if you have credible drug coverage, at least as good as Medicare, which again is through your company. So if you have an employer that has drug coverage, that counts. If you have VA coverage, that counts. Okay, you don't have to get a drug card if you have VA or company coverage. Okay, now the Part D premiums, just like they charge extra for Part B if you're in a higher income tax bracket, they also charge more for Part D. You'll see here now the tiers again, for individuals and for people filing jointly. Okay, let's go back to my example I used before, where my wife and I made $350,000 back in 2018. All right, so I go down to what, tier 5 there, greater than 326 but less than 750. I'd have to pay $70 extra, and so would my wife, plus the plan premium. So again, when you start adding the premiums up for the supplement and your drug card, plus the extra charges for part B and D, you can see it gets pretty expensive. But again, we can reduce these charges if our income is lower this year by filing that appeal with the Medicare office and saying, look, we're not making that kind of money anymore. I'm retired, my wife's retired, whatever, I had that windfall, I'm under 174,000, and they will reduce that extra cost they charge you back down to the normal premium the following month. So very important to recognize this. So if you know anybody else that's in this boat, okay, in this situation, make sure you mention it to them as well. That's what we're trying to do here. And kudos to Jeff for allowing me to do this, because a lot of financial planners don't even offer this up to their clients, which is, I think, is a travesty, because this is such a huge part of retirement, our healthcare costs and Medicare costs. And if you don't do it right, you can be paying penalties for the rest of your life. So thank you, Jeff, for allowing me to do this tonight, because I love passing the word along and educating people on this, because again, the government does a terrible job of doing it. Now, access to our drugs under Part D. There's a few different ways the insurance companies are going to kind of limit our control over our drugs that we want to get. One of them is through what's called a formulary. It's a list of covered drugs that each insurance company offers. So when you leave your company plan or maybe your individual plan, the first thing you're going to do is to check and make sure that whatever Medicare drug card you go on covers your drugs, because a lot of them will not, especially if they're brand names. If they're generics, probably no problem. Cheap generics, all the drug cards will cover those. But those expensive brand names, you need to do your homework before you sign up for a drug card. And that's what we do for our clients. You can do it yourself at medicare.gov, the website. You can go there. They have a tab you can click on. You list your drugs you're taking, your zip code, and it will tell you all the different drug cards that are available in your area, as well as your total cost out of pocket. And that can be significant. I had my wife's cousin, who I did this for, I did the research for. She's unfortunately has diabetes, she's had breast cancer, she's on a number of brand name drugs, insulin, you name it. I did the research for her. The first 3 drug cards that came up were all pretty reasonable. Her total out-of-pocket cost for the year was going to be $4,000. The 4th best drug card was going to be $11,000. So if this poor woman did not get into the right drug card when she was eligible for Medicare, she would be paying, could be paying an extra $7,000 a year for her prescriptions. This is something you need to look at every single year if you're on brand name drugs, because a lot of times the insurance companies will change this list, this formulary list. They'll take drugs off, put new drugs on. They'll change the tiers, which I'm going to go over in a second, the level of copays you pay for each drug. All right, so you have to do this homework and research every single year, preferably obviously during open enrollment, which is from October 15th to December 7th. It takes effect for the following January 1st. So for every year, you want to do your homework in the fall so you can change your drug card if you need to January 1st. Prior authorization. Even though, let's say you've been getting a drug from your insurance company with no problem, when you go on Medicare, it could be a problem. The Medicare plan you go to, okay, might say, well, no, we don't cover that drug, or we don't want you to take that drug. We want you to take a cheaper version. And what they're going to ask you to do is this, what's called step therapy. Okay, they're going to say, well, if you're taking this brand name, why don't you try this cheaper generic first before we cover your brand name? And then they say, well, if you can't take that, how about the next step up? Can you take this other drug that's cheaper than your brand name? So they're going to make you go through this whole process unless you head it off at the beginning and have your doctor write a prior authorization to get that drug immediately, so you don't have to go through the step therapy. So if you're taking something, you need it, you have your doctor write the letter saying, no, we've tried the generics, they won't work. I want my patient to go on this brand name immediately. And then Medicare, wherever insurance company you're with, will 9 times out of 10 approve it, okay? But like I said, don't make them have you go through the step therapy. Quantity limits. The insurance companies are putting quantity limits now on a lot of drugs because, again, of the abuse, especially for opiates. I work with the Iron Workers Union, Local 25 out of Novi, and all these poor guys, when they retire, they've got bad backs, major pain from bad shoulders, knees, you name it, hips. And this one gentleman I worked with, his drug now has a 7-day limit. It's a painkiller, a very powerful painkiller. So he literally has to go to the pharmacy every single week to get his prescription. So insurance companies can also, again, provide or make you have these quantity limits. So you can't get more than, say, a 7-day or 10-day or 30-day prescription fill when you get it. Your adult beneficiaries also have network pharmacies they need to go to. So a lot of your chains will be in the network. That should not be a problem. But these independent pharmacies in your hometown may be a problem. So you've got to check, and that's also a thing that could be a problem if you're not getting your local pharmacy covered, all right, by your drug card. So something you need to research first before you choose the drug card. Is your pharmacy a participating network provider? Now, understanding that formulary. Again, there's going to be tiers. And all the insurance companies have the same type of drug card tiers. So the first couple tiers, 1 and 2, are your generic drugs. Your tiers 3 and 4 will be your brand names. Tier 5 will be specialty drugs. Okay, they're rare, very rare. But what each insurance company is going to have is a list of these drugs available online. At the bottom, you see, I just used Blue Cross for example. That's the website you'd go to find out if your drug is included on their list. So again, before you do anything, you want to check that. Okay. Now, there's different stages of drug coverage when we get a drug card. The initial stage is we pay co-pays. You might have to pay a small deductible on the first $4,020 of the cost of the drugs. That means the portion we're paying and the portion the insurance company is paying. So let's say it's a $100 drug. I'm paying a $20 copay. They're paying $80. Okay, so it's $100 total. So I'm taking a few of those, let's say, and maybe I'm taking some expensive brand names. When that reaches $4,020 in the calendar year, I now go into what's called the coverage gap stage, or what is formerly called the donut hole. At which point now, I've got to pay 25% of the cost of the drug out of my pocket. So I went from a low copay in the initial coverage stage for that brand name, and now I've got to pay 25%. So if I'm taking an expensive drug, say it's $2,000 a year, I'm sorry, $2,000 a month, my 25% is $500. I have to keep paying that now every month until I reach my out-of-pocket cost of $6,350. Now, this $6,350 is cash out of my pocket. Do not confuse that with the first number I gave you, the $4,020, which is a combination of the insurance company portion and my portion that was paid. This $6,350 is actually cash that I had to pay out of my pocket, okay, before I hit what's called the catastrophic stage, which is next. Okay, once I hit the $6,350, now my cost sharing goes down again. So I pay very small co-pays on everything. The most I pay on my brand name that I gave you before, that $2,000 drug, would be 5%. So 5% of what 2,000 is, what, $100. So it's not too bad. So we have good coverage up front in the initial coverage stage. We have good coverage on the back end, but we pay a lot more in the coverage gap. Now, great ways to save money on prescriptions is by going to the right pharmacy. I don't know if you've heard of GoodRx. They're starting to advertise now on TV, but I've been using this and advising my clients for years on this. What GoodRx is a website you can go to. You can put your prescription in, your dosage, the number of pills you need, and then it will give you a printout of all the different pharmacies in town and what they charge for that drug. And the disparity in between or among pharmacies can be huge. Because you can go to 5 different pharmacies in town and get 5 different rates. And it can be a huge difference in cost. The best ones we're finding now, I mean, we have like Sam's Club and Costco are really good, okay? Myers, Kroger's, Walmart, very good. They're really kind of, the more expensive ones are turning out to be the CVS, the Rite Aids, and the Walgreens of the world. So what GoodRx can do for you is they can show you what everyone is charging for that drug. They also give you coupons. Now, anybody can use GoodRx, even if you're under 65. And if you're under 65, you can use the coupons. If you're over 65 and on Medicare, you cannot use the coupons. But you can get the discounts. So when you go to goodrx.com, you'll see some drugs do have coupons. Some drugs might have a discount. I'm sorry, some pharmacies might offer coupons, and other pharmacies might offer the discount. Those you can use. So what we need to do, we all need to get in the habit now of asking our pharmacist, what's cheaper? Is it better for me to use my health insurance card, or is it cheaper for me to use this GoodRx price? And by law, they have to tell you. They don't have to offer it up initially, but if you ask them, they have to tell you what's cheaper. Because a lot of times now, it's cheaper to pay cash than it is to use our insurance cards or even our Medicare card. And again, anyone can do this. Under 65, over 65. Please make sure your family, your friends, neighbors, everybody knows about this. Great way to save money because we're getting shafted by the pharmaceutical companies here in America. They're overcharging us, and any way we can fight back, I'm going to try. Sam's Club and Costco, the buying clubs, you do not have to belong to the club to use the pharmacy. It's a state law that we can buy alcohol there and our prescription drugs without having to pay the membership fee. So again, you can use those places if you find that they have the best prices in town. You can use them without joining their club. I've also taken it a step further for my clients, and now I'm getting a lot of prescriptions when people hit this coverage gap stage out of Canada. I use their mail order pharmacies. They're all accredited. It's the same drug we get here in America, but literally it's up to 90% off on a lot of the prescriptions. We can't get everything from Canada. There's some things they don't offer. We cannot get any kind of mental nervous drugs back here, like for instance Zoloft, Xanax, Adderall. Can't bring that across the border, okay? But we can get most everything else. In fact, insulin, if you know anybody on insulin, because it's a crime what we pay here for insulin, over there it's a third of the cost, and you don't even need a prescription for insulin in Canada. So normally you could drive over to Windsor, pick up your insulin and bring it back. Because the borders are closed right now, can't do that, all right? But when they do open back up, tell everybody you know that's on insulin dependent, okay, that there's an option in Canada for them to take advantage of by just going across the border. There's literally 100 pharmacies in Windsor. Okay, they don't have the chains like we do, but they have a lot of independent pharmacies, and I can tell you right now, the prices are up to 90% off. If you need help on this, this is where I come into play a lot for my clients. I find the right drug card for them for Medicare. I also show them how to find the best prices on their prescriptions using either GoodRx locally or Canada for the expensive brand names. Okay, so feel free to call me or reach out anytime, because again, it's like David and Goliath. I love playing David to the pharmaceutical company's Goliath. I love beating them at their own game. Now, there's two types of Medicare supplements. This is where we come into Part C. Part C is basically called Medicare Advantage plans. And what these are the new and improved Medicare supplement plans. These are offered by insurance companies. They're available throughout the country. We have to get one that's in our area, so we have to get one that's Michigan-based. The premium is not based on our health. They don't ask health questions. Okay, we can't be denied, okay, for coverage. Okay, Medicare basically pays the insurance company to handle parts A and B on these, which means when you start seeing all these ads on TV, okay, coming up pretty soon because open enrollment starts October 15th, which is going to be unfortunate because between the Medicare ads on TV and the campaign ads that we're going to be seeing for the next 2 months, that's all we're going to be seeing. I think they're going to have more time to devote to those than the actual TV shows themselves. So when you see the ad that says a zero premium plan, it's true. You can get one of these Medicare Advantage plans for nothing. The reason why is that the government is paying the insurance company a monthly stipend to have you enrolled, and it's a very handsome stipend. Typically a minimum $500 a month is what Medicare will pay the insurance company to handle parts A and B for them. The government knows they can't do a good job of handling A and B with all these baby boomers turning 65 every day. So they're saying, look, insurance company, you handle it for us. We'll pay you to do it. So the insurance companies are making a fortune on these Medicare Advantage plans behind the scenes. So they're reducing the cost down to zero. They're adding all these bells and whistles to these plans, like a free gym membership and a lot of other added extras I'm going to show you in a second, okay, to get people enrolled, because again, they're making the money not from us, but from the US government. Okay, you still have original Medicare when you have a Medicare Advantage plan, which means you still have to pay your Part B premium every month. You'll still have your Part A, okay, so you got to keep that in place when you add your Medicare Advantage plan. You still have the same Medicare rights and protections. You get all the same services, but instead of having all like 3 cards, you're going to have 1 card from the insurance company, and that's going to handle everything. You're going to have, so your pharmacies, when you go to the pharmacy, you go to the doctor's office visits, you go to your labs, your x-rays, your hospital visits. 1 card is going to take care of everything because your insurance company is handling it all for their portion and for the government, Part A and B. As I said before, they also add a bunch of extra benefits, like vision coverage. Because remember now, Medicare does not cover vision. They don't cover hearing. They don't cover dental care. They don't cover fitness programs. You have to get that on your own, and these Medicare Advantage plans, most of them will include these things, all these extra bells and whistles. Most Medicare Advantage plans will also include your drug card. So you don't have to worry about getting a separate drug plan when you have a Medicare Advantage, because it's all going to be included under that 1 card. Okay, when can you enroll in one of these? Well, the open enrollment period is October 15th through December 7th. Obviously, when you turn 65, you're eligible. There's also this open enrollment period from January 1st to March 31st, where you can switch plans and disenroll from plans if you want. Okay, you're also eligible if you're institutionalized. So if you know anybody that's living in an institution, okay, they are eligible to change your plans at any time during the year. Also, if you're in a nursing home facility, so nursing, assisted living, memory care center, whatever they call it, if you live in one of those long-term care facilities, you can change your plan at any time. You can get into one of these Medicare Advantage plans. As long as you take a plan that's in your area, okay, it's a qualified plan, you have no problem. If you're losing your group health insurance, that's GHP there, you can get into a Medicare Advantage plan again. So if I'm retiring June 30th, my Medicare Advantage plan can pick up July 1st. No lapse in coverage, no health questions asked, great coverage for 0 premium. Special election periods for your prescription drug plan. That's what that PDP means. Okay, if you lose your drug card somehow through either your company or through VA or some case like that, you are eligible at that point to pick up another drug card. Okay, with no questions asked. Okay, all these Medicare Advantage plans have star ratings, rated 1 to 5, 5 being excellent, 1 being poor. Most of the plans in our area are going to be 3 or better. Okay, now the insurance companies make more money from the government by having a higher rating, which means the insurance companies are going to try to keep you happy by keeping you healthy, by taking care of your issues when you call in to your customer service, okay, and dissatisfaction with your insurance company, you let them know, because that's going to affect their star ratings, and it's also going to affect the amount they get paid by the government. The other thing too, when you work with someone like me as a consultant, first of all, I don't charge anything. I get paid by insurance companies. So if you work with myself or another agent out there, okay, I would suggest calling your agent when you have a problem. A lot of times when you call these insurance companies, their customer service 800 numbers, it depends on who you get, of course, but some people, I don't know how they get hired or how they keep their job, because they don't do a good job of giving you the right information, or they put you on hold or whatever. So a lot of times I have these people call me, my clients call, so Jim, I was on hold for an hour. I said, no, don't ever do that again. I've been doing this 27 years. I know the right people to call. Call me, and I get the status or taken care of for you a lot faster than they can. So again, whoever you work with, you might want to call your agent sometimes instead of the insurance company. I know it's part of their star rating, but still, I'm just trying to make it easier for you. Now, to be eligible for Medicare, again, you have to have Parts A and B. You got to keep your Part B premiums paid. You have to live in the planned service area, which means if you're spending a lot of the time down south in the winter, like a lot of us snowbirds do, okay, you have to set a base state for your Medicare Advantage plan. So if you're spending 6 months here and 6 months there, you want to tell the insurance company, yes, your base is Michigan. I'm only going down to Florida for whatever, my time period. All right. I do have some people that buy RVs and they travel the country for a year or two. They have to set a base location for their Medicare Advantage plan. So hopefully they have a son or daughter that lives in Michigan. You use their address as the base, okay, because that is important, because you don't want to get caught up in these rules and regulations where they try to switch you around in the middle of the year on your Medicare plan. Lastly, you can't have end-stage renal disease. That is another program the government has. They have a special program for it. So you can't get a Medicare Advantage plan if you have end-stage renal disease. Okay, how they work. Again, you're going to get all your services from Medicare as you normally would. It's all going to be covered. They're taken care of by the insurance company. They're going to include your drug card. Now, they're going to have a network of doctors and hospitals, though, that you have to see. Okay, and I'm going to go through that in a second, the PPOs versus the HMOs. But again, on these Medicare Advantage plans, you have to use a doctor that accepts it. And that's why I use the big national carriers only. I don't use the small companies because I have too many people that travel or go down south for the winter. I don't want a plan that's regional, meaning they're just Michigan-based. I need national plans for my clients. Okay. Now, the benefits and cost sharing may be a little different from the original Medicare. All that means is those deductibles and copays I showed you before, the insurance company will give you their own deductibles and copays. They're going to take Medicare and just revise it and give you maybe different deductibles and copays. That's all that means. Okay. Now, networks. The PPO network is the big one. That's where most doctors take. Okay. You don't need a referral. You don't have to have a primary care physician. Okay. You can pretty much go anywhere you want, anytime you want, as long as you're in the network. The bottom one, the HMO, Health Maintenance Organization, those are smaller networks. You have to name a primary care doctor, and to see a specialist, you have to get a referral from your primary care doctor to go see that specialist. The middle one, the HMO point of service plan, is a hybrid of the two. It's basically an HMO that allows you to go out of network. But with the advances now in these Medicare Advantage plans, don't even look at an HMO plan or an HMO POS plan. If you can get a PPO plan for free, again, the premium every month, there's no reason to even look at an HMO anymore. These are going to be dinosaurs in another year or two. Now, the other type of Medicare plan is supplement plan. These are the old style Medicare supplements, also known as Medigap plans. They're the exact same thing. Okay? They're referred to either way. Again, they're offered by health insurance companies. All right? They supplement what Medicare doesn't pay, like 20%. Okay? They're typically lettered A through N, which I'll show you that in a second. Okay? Now, they can ask health questions. Okay? And they can also vary in cost by where you live, your age, your gender, if you're a smoker or not, the company you're with, the plan you take. All right, so there's a lot of variables that go into the costs here. Remember now, with the Medicare Advantage plan, if it was a zero premium, they didn't care if you were 65, 85, or 105. With these plans, it does matter. They typically go up every year with your age. So they start you off low, typically around $120, $125 a month. Okay, again, this is just the Medicare supplement, not including the drug card. All right, so you're going to start off, say, $125 a month. Next year, it'll be $135, following year, $145. So it's going to go up pretty much every year, $9 or $10. Again, depending on your plan. Okay, you also, if you're older, when you first go on Medicare, you're going to start off at a higher rate because of your age. All right, the company, the insurance company you go with, obviously, they're going to have different rates. So you have definitely some shopping around we have to do when you look at Medicare supplements and this monthly premium you pay. Okay. Now, the best time to buy the supplement is during your open enrollment period. This is when you turn 65 or when you leave your group plan. When you retire from your group, you have your basically your open enrollment period with no questions asked to get into a Medicare supplement. Outside of this open enrollment period, they're going to ask you questions. So you're going to have 6 months after you turn 65 or after you leave your insurance through your company to get a Medicare plan with no questions asked. Again, after that, they're going to ask questions. They can charge you more based on your medical conditions. They can also deny you if you have too many serious conditions. Okay? So if you are a sickly person or have a poor health history, when you turn 65, you should give special consideration to getting a supplement plan versus a Medicare Advantage plan, just because there's no questions asked on your coverage. If you start off with a Medicare Advantage plan because you like that low premium of $0 every month, and you decide you want to go to a Medicare supplement plan a year or two down the road, they're going to ask you questions. And again, they're going to rate you up if you have health conditions. They don't rate you up much for the basic stuff, you know, high cholesterol, high blood pressure. If you have something serious, yeah, you're going to be paying a lot more than you normally would because you're getting in after your open enrollment 6-month window. Okay. Now, all these plans are standardized by Medicare, meaning they're all the same. So if you go to XYZ company, ABC company, it doesn't matter. They're all the same plans. They can charge different amounts, but they're all the same plans, as you can see here. So if you get, say, a Plan G from Blue Cross or United Healthcare or HAP, it's the same Plan G, same parameters, okay? Again, it might vary on cost, but the coverage is the same. Now, most people this year are going with Plan G because, as you can see, it covers 100% of pretty much everything except for down toward the bottom. You have a Part B deductible it doesn't cover, which this year is $198. And they have the foreign travel emergency covered at 80%, which is common on all plans. So if you're, again, an unhealthy person and you get into this Plan G, the only thing you'll have to pay out of pocket for your medical expenses is $198 the entire calendar year. So if I've got cancer, if I have a poor health history, I'm going to rehab, whatever the case may be, where I feel like, hey, I'm going to be paying a lot of co-pays with my Medicare Advantage plan, I'd rather just go with a Medicare supplement plan, pay the $198 and be done with it for the year. Okay, you have that option. If you were born before 1955, you can also go into what's called Plan F. They discontinued plans C and F this year, okay, because of this law change 2 years ago. Okay, but Plan F, as you can see, covers 100% of everything. You will pay nothing out of pocket for your medical expenses. Zero, because they're covering everything. Now, it's expensive. It's not going to be cheap to get in this plan. But again, I have these, like some of these really wealthy people come to me and they say, Jim, I want the best plan you got. Well, this is what I would give them in the past. Now I give them Plan G because that's the only thing that's available for people that turn 65 this year or later. Okay, but these are the plans you can get into. They're all priced differently. Okay, but in my opinion, you're going to want to take a serious look at Plan G. Because to me, that's the best value. Okay. Now, important notes. You cannot have a supplement plan with a Medicare Advantage plan. You have to have one or the other. Medicare supplement plans do not cover prescription drugs. Again, they don't cover dental, vision, gym memberships, anything like that. They just cover medical only, which means you have to get a separate drug card in addition to the Medigap plan. You cannot have more than one Medicare supplement. Why you'd want to, I don't know. But you can only have one Medicare supplement at a time. Okay, you should not cancel a supplement before you know you have a new one in place. What all that's telling you is that, say you want to change January 1st and you cancel your first plan, but then wait a minute, the plan that you were going to January 1st is saying, we're going to raise your rate because of your health conditions. Or guess what, we're going to deny you because of your health conditions. You never want to cancel an insurance plan until you know the other one is up and running and approved. Okay, you do get a 30-day free look, meaning if you get into a plan, you don't like it, you can change within that 30 days. If you enroll in a Medicare Advantage plan, it does not automatically cancel your Medicare supplement. You have to do that yourself. So when you're in a Medicare Advantage plan and you switch to another Medicare Advantage plan, it will cancel the first one automatically. But when you switch from Medicare Advantage over to Medicare supplement, you've got to cancel a Medicare supplement on your own. Okay? Now, on auto insurance, Medicare does not cover auto accidents as primary. So this new law change with the new no-fault coverage we have in Michigan, where you can reduce your costs by taking out the PIP, the personal injury protection, what you need to do is call your auto insurance agent and ask them how much is it if I were to remove that PIP coverage from my auto insurance? If he or she gives you a cost of, say, $200, well, it's not worth it. What Medicare covers versus no fault, there's a big difference. No fault is like your Mercedes-Benz coverage, okay, for your lifetime. So to save $200, it's not worth it. If you're saving $500 now, okay, and maybe you're on a strict budget, or maybe I had like one client, he had 3 cars. He was going to save $500 a car by taking that PIP off his plan. He said, well, geez, Jim, at $1,500 a year, that's not a bad deal. I'll have Medicare take over for my, my auto accidents, or I should say not my auto accidents, but my long-term care. Oh, that's not, I shouldn't say long-term care either. My long-term issues, okay, because Medicare does not cover long-term care, okay? That's a totally separate policy you have to get, okay? But I'm talking about your long-term health issues. Medicare will cover those, but not as well as your no-fault insurance would. So again, it's something to look at with your auto insurance agent to see if you want to change or not. I have a really good flyer that explains this. In fact, I emailed all my flyers today to Jeff before the meeting. He's got a really good one now on whether you want, if you have an HSA and you're still working after Medicare age, there's a good one comparing your Medicare insurance to your auto insurance, your Part D and Part D extra amounts if you pay for, and just other like, tips when you're still working after 65. Like again, not signing up for COBRA. So Jeff has all those handouts, and you can, I can send them to you if you want. He can send them to you, but they're good reading. There's a lot of good information in those, so I would encourage each one of you to take a look at those, especially when it comes to this auto insurance question. Okay, so now to sum up the 2 plans in picture form, you got 2 options. The one on the left is the Medicare supplement. You have your Part A, your Part B coming from original Medicare. You have your Medigap or Medicare supplement plan from the insurance company. You also have a standalone Part D drug card. All 3 now, you're going to have basically 3 cards you have to keep in your wallet or your purse. Okay, your original Medicare card, your Medicare supplement card, and your Part D drug card. On the flip side, the Part C Medicare Advantage plans, you only have the 1 card. That's going to cover everything. Your doctor's office visits, labs, x-rays, hospital visits, prescriptions. It'll get you the free gym membership, all these other bells and whistles they throw in on these plans. Okay, but that's the difference. So when people come to me and I do my one-on-ones with them, like this is a general overview of everything, but everybody's different. Everybody has different budgets, different needs, different health care. All right, I sit down with people on a one-on-one and go through everything with them to determine what's best for them. And typically my first question is, how's your health? Because I can tell you right now, more than 90% of my clients take the Medicare Advantage plan because it's so cheap and of all the bells and whistles that are attached. The ones that don't are the ones that are unhealthy. Those are people primarily go with Plan G, like I mentioned before, because they can get really good coverage, only pay $198 this year out of pocket for all their medical expenses. So again, that's where you need to sit down and do some fact finding, okay, some discovery, go over it with a person like me to see what your particular situation is and to determine what plan is best for you, not just this year, but also maybe review this every single year as open enrollment comes up. So that's it, okay? Here's my contact information. You'll see here Medicare. You can go on Medicare.gov. It's a great website, has a lot of good information. I frequent that a lot, all right, to get details. You can also call them at their 800 number. They've actually been pretty helpful with my clients. They're answering the phone on a reasonable basis. I've had a couple of people tell me they're on hold for half an hour, but most of them are getting right through. Prescriptions, the local pharmacies, as I mentioned, to compare drug costs locally, thegoodrx.com, great website. Please pass it along to everyone you know. Over 65, under 65, it doesn't matter. It's a great website to use to find out the best prices in town for prescriptions. Canadian pharmacies, that's my website, askhealthinsuranceconsultants.com. We can get drug costs for you out of Canada, get them shipped to your house, get a 3-month supply. It's kind of slow right now because of the postal service, but it usually was taking about a month. Now it's taking about 2 months. But again, if you can save 90%, why not? Again, my name, our health insurance company consultant is my name or my company name. I'm Jim Bokshan. There's my email. You can see my website. my phone number. So what I'm going to do now is we're going to open this up, okay, for questions. All right, so I'm going to go over to Jeff now and make him the host. All right, and anybody has any questions, I will be here for as long as you want, okay? Jeff, can you hear me?
I sure can.
All right.
Great job. So just kind of a recap, and one of the reasons why I wanted Jim on is that I know, and he has helped many of my clients take care of, this just such a complex task of really understanding the 29 options you have just for a drug card, let alone all the different plans that they have available and the two sections, whether it's Medicare or the Medicare Advantage. And the nice thing is that I think, Jim, you really need to say this again, is that, or I'm going to say it for you, is that there is no cost to use you. If I'm correct, you can go direct to Blue Cross and get the same exact plan that someone would come to you, but you have the ability to shop it to 20 other companies or all of the companies. Is that correct?
Right. So I bring 27 years of experience to the table. And unfortunately, when you call insurance companies, you get that 800 number, there's no telling what you can get on the other end of the line. They could be a person with a lot of experience. They could be a person with very limited experience. So I always encourage, if it's not me, use any agent that's out there, because they're going to help you out with this myriad of plans and issues and exceptions. And you got to know the rules, because if you don't, you can get burned.
Okay. So that's, there is no cost, and Jim is a very wealth of knowledge. So if you were to ask me a question, more than likely, I'm going to be asking Jim anyway, or I'm going to be passing them off to you. So he's a wealth of questions. So we have one question here. It says, my husband is retired. I am not. And can you explain again the issue of a spouse retired when the other one is not?
Depends on the age. So if that retired spouse is over 65, he or she has the opportunity to stay on the other spouse's company plan, or they can take an individual Medicare plan on their own. They can carve themselves out of the spouse plan and go on their own, which typically is the better thing to do, because what's happening now with a lot of employer plans, they've had to raise deductibles to keep the costs low. They've had to have the employees pay more for coverage. And unfortunately, because of the Affordable Care Act, health insurance now is age rated. So as you get older, the rates go way up. So if I have a 65 or 64-year-old, let's say, on a group health plan, it gets very expensive. And the company, the employer, might be charging that employee a lot more to have that spouse on there. So 9 times out of 10, it is cheaper to go on an individual Medicare plan than it is to stay on the employer plan. The employee can still keep their coverage, okay, no questions asked, right, and then come off anytime they want to. But yeah, if my spouse is Medicare eligible, I'm looking into a Medicare Advantage plan or a Medicare supplement.
Right. So if you'd like to ask a question, you can go ahead and type it in the question and answer, or go ahead and raise your hand, and we can do it auto. I can unmute your audio.
They can push the space bar down too, I think, to talk.
Okay. Well, I think I have to unmute him for some reason, but.
Oh, okay.
So now I think there was a lot of information, and I don't see any other hands up, but here's the thing is Jim did pass along a lot of information. Whoop. Let's see. Let's say, okay, another question, same person, another question is, okay, let's say I don't work anymore, but my husband is on Medicare. So how would the under 65 spouse, how would that work?
Okay, 2 things. Obamacare, you can always get an individual plan. Everyone's eligible. Open enrollment is from November 1st to December 15th for the following January 1st. So that's when we have to sign up for an individual plan. Again, no questions asked, no pre-existing condition limitations, no waiting periods. We can get in. The problem with individual plans now is they're almost all high deductibles and high cost. Like when I say high deductibles, I'm talking $6,000, $7,000, $8,000 deductibles. Cost-wise for a 63, 64-year-old, you're looking at $500 for just a basic plan. So the costs are very high for an individual under Obamacare. There's one other option I use more and more often. It's basically what's called major medical insurance. You can only get it for 6 months at a time, okay, but it's a lot cheaper because they don't have all the bells and whistles attached to it like an Obamacare plan would have. So there's no maternity coverage. There's no mental health coverage. There's no allergy testing. There's no chiropractors. They just cover you if you get sick or hurt. But the cost is relatively cheap. You're looking at about maybe $150 to $200 for a pretty decent plan with a lot lower deductible. They have deductibles like $500, $1,000, $2,500. They're very affordable. And that, unfortunately, is what many of my adult in their 60s clients are going to because they can't afford Obamacare at $500, $600. I've had one lady, she was paying $1,100 a month for her plan, just herself alone, which is ridiculous. So again, that's where I come into play. I quote both. I quote Affordable Care Act plans. I'm independent, so I'll shop around HAP and Priority and Blue Cross and Blue Care Network, all the big names in town, as well as these short-term plans. And let my client decide what's best for them. And hopefully that short-term plan will be enough to tide them over until they hit Medicare, and then where the rates go way down again.
Great. So now we have a couple more questions. So what you're basically saying is you can help before 65 and then after 65.
Yes. So
Okay.
What I've been doing for these last 27 years, I've been working with individuals under 65, individuals over 65 that are on Medicare, and also small groups. So I have a lot of like employer groups, about 160 groups that I also work with that I'm their agent on their plan. So I do from birth to death. So call me again. Jeff's a great guy. I've known him since my kids were, in fact, he was my kid's 3rd grade soccer coach, and they just graduated college this year. So that's how long I've known Jeff. But anyway,
right,
use me as a resource. I'm here for you just for questions. I don't charge. I'm just here to help, literally, because I figure if I do a good job, you'll think of me when you do one Medicare down the road.
We have a question here. So if one takes Plan G, is that the only thing they have to pay for?
What takes Plan G?
So if an individual takes Plan G,
Okay.
is that the only thing they have to pay for?
No. Okay, Plan G is the Medicare supplement. You have to have a drug card on top of that. You also have to pay for your Plan B. I'm sorry, Part B. So your Part B, if you're in a normal income tax bracket, it's going to be $144.60. Okay. The supplement, depending again your age, your gender, smoking status, your location, roughly about, let's say $125 if you're 65. Your drug cards then cost you about a minimum $13, $14 a month. I use those a lot for the people that are just taking cheap generics because again, you have to have drug coverage. So let's do it the most most inexpensive way at all, and that's a $13 drug card. Some of the drug cards go as high as 100 and something if you have to take a lot of brand names. But your total costs per month are going to be your Part B, your Medicare supplement, and your Part D drug card.
Okay. Amy, did that answer your question? I'm going to allow you to talk.
Yes, thank you very much. Appreciate that.
Great. Okay, we have another question. This one's from Matt. If I decline A and B when I am 65, because I am working, I will be penalized, or will I be penalized if I drop my company's health coverage?
Yes. Okay, if you're dropping everything, if you're not taking A and B, and you're not taking your company plan, you basically have no coverage, yes, you're going to be penalized for not having Part B and Part D, your drug plan. So yeah, you don't want to do that. You don't want to go bare, right, without anything, because you will be penalized, and that penalty lasts the rest of your life. So it's not a good idea to go without coverage, even for the simple fact that, hey, if something happens, you're not covered. That could be hundreds of thousands of dollars of bills you could be paying.
So Jim, why do they have that penalty? What's the thought on that? I mean, I understand it, but could you explain that?
It's the same reason that the Obamacare has a penalty, because they don't want people to get in when they become sick. They want to get people in at age 65 when they're healthy, start paying all the premiums, paying into the system, so that when they're unhealthy down the road in their 70s or 80s, the insurance companies, the government has collected enough money to help pay for this. It's a simple rule of insurance that you're not going to allow a person to get in. For instance, on car insurance, you can't get in after you have the car accident. Same with health insurance. They're not going to allow you in when you get sick. They want you to get in at a certain time period, like when you turn 65, or individual coverage, January 1st, you have to get in if you're under 65. And if you don't get in there at that time, you're out of luck. Okay, they're not going to cover you until next year's open enrollment period. That's the reason why. The insurance companies are just protecting themselves from adverse risk.
Great. So Matt, I'm going to let you talk. Did that answer your question, or do you want a follow-up question?
Jim, thank you very much for today.
Sure.
If I elect to decline Part A and Part B when I'm 65 because my coverage with my company is really good, and then, let's say several years later, I want to stop my company's coverage, will I be penalized then if I move to Part A and Part B?
No, not as long as you worked at a company with more than 20 employees.
Okay.
So if you're a small company, yes, they would penalize you, less than 20 employees. But if you're at a large employer, the large employer health plan is going to be primary. You do not need Medicare when you work at a large employer when you're 65 and older. You will not be penalized for not having your A and B at that point.
But when I do elect to eventually get Part A and Part B, I won't be penalized because I didn't select it when I was 65, right?
Nope, there'll be
Okay.
no penalty when you
Good.
go to sign up. So let's say you say, okay, I want off the company plan September 30th. I want October 1st as my start date under Medicare, Parts A and B. Yes, they'll sign you up as of October 1st. No questions asked. Because you had that coverage already through your company, that was a qualifying event, okay, or a reason to have coverage. You did not need A and B back then. So there'll be no penalty when you go to start up October 1st with Medicare.
Great. Okay. Thank you very much.
Sure.
Okay, let's see here. So Roseanne, let's see, did we answer everything for you? I'm going to go ahead and allow you to talk.
I'm here.
Okay, great.
Thanks, Jeff.
Yep.
So if I'm retiring and my husband is already retiring and I haven't, well, let's back up for 1 second. If I didn't work for 10 years and my husband worked all those years, can you re-explain the where we can get Medicare?
Sure. Because your husband worked at least 10 years and paid his FICA taxes, all right, you qualify under your spouse for Medicare Parts A and B. So a spouse does not have to work at all if they have a working spouse. Okay, so you're basically exempt from any penalties or any extra charges because you're qualifying under your spouse because they worked at least 10 years.
Okay, so do we have to sign up for that prior to us turning 65? Or can we stay at with our husbands?
Yes, you can stay with your husband's plan. When you turn 65, you can stay on your husband's employer plan. Everybody, when they turn 65, has that choice. You can stay on the group plan, or you can go off on an individual Medicare plan. So you're going to have the option at that time to do either one. And that's what, again, I sit down with people and we punch the numbers. We find out how much the employer is charging you. We find out what the plan is like. Does it have a big deductible, small deductible? Is it going to be more expensive or not for you to leave the group plan? That's what we do together. We sit down and figure out, kind of punching the numbers, figure out what's the best plan for you.
Okay, well, I'm going to be moving to South Carolina or North Carolina in March. And my husband is on Medicare already. He's retired. He's 70, and I am not at retirement age. So if I move down there, can I piggyback on his Medicare?
When you become Medicare eligible, yes. If you're going to be under 65 when you're down there, you can't get on Medicare unless you're disabled. So I'm assuming you're not. So you'd have to get an individual plan when you move down to the Carolinas. Okay? Because you're not
Okay.
Medicare eligible until you're 65.
Okay, so there's no way that I can use his Medicare.
Not until you're 65.
Okay, all right, thank you.
Sure.
Good question, Roseanne, because yes, you know, the group plans, some large employers will allow you to, will take care of your husband's or spouse's plan or coverage, but Medicare is an individual thing. Is that correct, Jim?
Right.
So it's just
Correct.
on your individual age. Correct.
All right, well, that was good information. Thank you.
Thank you. All right, well, I don't see any more questions. We'll wait another 30 seconds to see if,
For the slow typist.
yeah, exactly. Well, I see a couple saying thank you and great presentation. So great job, Jim. We really appreciate you doing this today.
Thanks for having me, Jeff. I think this is a fantastic. I think you do this for your clients.
Yep. So it's much needed stuff. So any other questions here? You can either go ahead and type, or you can just go ahead and raise your hand.
Or if they think of something after the meeting, maybe tomorrow, you can always reach me through you. If they have my contact information, they can always contact me. Again, I'm here for questions anytime.
Okay. Well, thank you, everyone.
All right.
We appreciate it, and don't hesitate to call if you have any questions.
All right. Thanks, guys. Thanks, Jeff.
Thank you.